Okay, Supervisor Corsey, we are live.
Thank you, Paul. And thanks to everyone for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communications staff, a message for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Supervisor Corsey.
Gracias, Gilbert. I'm Chris Corsey, representing District 3 on the Sonoma County Board of Supervisors. Welcome to our COVID-19 and vaccination community briefing for Monday, June 14th. The final briefing before California's reopening tomorrow. So beginning tomorrow, June 15th, most of the state's blueprint restrictions that have been in place since August are going to go away. Places of business will not be bound by capacity limits. You're free to gather with friends and family, and we're all poised to jumpstart our economy. Life is going to seem much more normal for the first time since the start of the pandemic. We want to make clear in this briefing today that here in Sonoma County, we will align with the state's guidelines. Due to our high vaccination rate and widely available vaccine appointments, as well as our low hospitalizations, we're ready for the reopening. But as our lives open up again, we need to remember the pandemic is not over. We want to remind everyone today that we have work to do to get the vaccine into more arms. This is absolutely necessary to control the spread of the virus, which is continuing to circulate among people who are unvaccinated, particularly young people. In a moment, our vaccine chief, Dr. Urmila Shinde, will give us an update on where our vaccination campaign stands during this important juncture in our 15-month battle against COVID-19. But first, our health officer, Dr. Sundari Mays, will talk more about where we are in the pandemic and what tomorrow will look like in Sonoma County. Dr. Mays?
Thank you so much, Supervisor Corsey, and thanks to everybody else for participating. I am really happy to say that we have turned a corner in the pandemic and we are ready to fully reopen our economy. However, it's too soon for us to declare mission accomplished. We are still finding COVID cases in the community, especially in unvaccinated young people, as you'll hear shortly here from a slide presentation that we have for you. Although we're not seeing hospitalizations and deaths that we experienced during the darkest days of the pandemic. As the Supervisor Corsey just said, our main reason for this briefing today is to make clear that Sonoma County, as just about all counties in the state are doing, will be aligned with the state reopening plan that begins tomorrow. There are no special health orders in place that differentiate us from the rest of the state, which has been the case for some time. That said, we know that there is some confusion about what is in store for Sonoma County, particularly in the area of facial coverings. But here is what there is no confusion about. Because of our tremendous progress in getting people vaccinated and bringing down our case counts here in Sonoma County and across the state, beginning tomorrow, businesses will be able to open up fully for outdoor and indoor service. This includes all restaurants, bars, wineries, and breweries. Movie theaters, gyms, and places of worship also will be allowed to open fully without limits. The same is true of museums and family entertainment centers. They also will be allowed to fully reopen to their normal capacity limits. Furthermore, there will be no more limits on private gatherings at your own home, park, or business. We can gather again with our families, friends, and neighbors, which is very exciting. I have been waiting to announce this for quite some time. In general, the only area where there remains some uncertainty is about the wearing of masks. Masks will still be required on airplanes, buses, trains, and all other forms of public transportation. They also will still be required in airports and depots. They also will still be required in hospitals and in K through 12 schools. I want to make it clear that neither the state California Department of Public Health nor the Sonoma County Department of Health Services is going to require the wearing of masks in locations such as restaurants, stores, and businesses. Guidance for the wearing of masks at places of business will come from Cal OSHA, which is expected to make a ruling this week. However, we still encourage people to be cautious, especially if they're not vaccinated. If you're not vaccinated, you should continue to wear your mask, especially when in public settings and in group gatherings. The spread we are still seeing in virus cases is primarily among unvaccinated people. Our data is showing that if you're vaccinated, you do not need to be concerned. You're protected. Right now, our case rate is down to 3.9 cases per day per 100,000 residents. That's down from a high of more than 50 in January. Although we're not seeing the hospitalizations and deaths that we experienced during the darkest day of the pandemic, we're still finding COVID cases in the community, especially, as I said before, in the unvaccinated. While we're aligning with the state and lifting all COVID restrictions, we want to still urge people to use caution, especially when they're out in the community and unvaccinated. The best thing that you can do to protect yourself and your community is to get vaccinated and continue to move Sonoma County towards that critical herd immunity. Again, you can get a vaccine appointment the same day. There is no shortage of vaccine. Please, if you're not vaccinated, go get that appointment and get vaccinated. Now I'd like to hand it over to Dr. Urmila Shende, our vaccination chief, to talk more about the effort to get everybody vaccinated. Thank you.
Thank you, Dr. Mace, and thank you, Supervisor Corsey, and thank you for everyone for attending tonight. We've continued to make great progress in our vaccination efforts. We've now administered at least 574,631 vaccine doses in Sonoma County. A total of 73% of eligible county residents, including those over the age of 12, have received at least one dose, while 63% have been fully vaccinated at this point. Given that a vaccine didn't even exist a year ago and only began arriving in Sonoma County a little over 6 months ago, it's a remarkable accomplishment. It's critical that we vaccinate as many of our eligible population as possible. As Dr. Mace noted, we're still seeing new cases, especially amongst young, unvaccinated people, mostly those under the age of 30. Many young people feel they don't need to be vaccinated because they're healthy. However, it's important to realize that every positive case leads to more transmission, which can affect someone who's vulnerable in our community. Every hospitalization and every fatality is a tragedy. We know now that COVID can be a preventable disease if we increase our proportion who are protected. So please do your part and get vaccinated. It's the best tool we have to reaching herd immunity and to putting COVID behind us. I'd like to go to our vaccine mission manager, Ken Tassif now, who'll talk more about opportunities throughout the community. And after Ken is done, we will go through some slides that highlight some of the points that Dr. Mace and I just made. On to you, Ken. Thank you.
My apologies. Sorry about that. Thank you, Dr. Shende. Well, we're still in a critical phase of our vaccine campaign. And with demand waning, we're stepping up our outreach efforts to prioritize the remaining 25% of the population that are 12 and older and haven't yet received their first vaccination. We've pivoted from our fixed site vaccine center strategy to a more strategic targeted approach in an effort to bring vaccine into the neighborhoods where people live instead of having the people have to come to us. This strategy includes both mobile vaccine units and pop-up vaccine events across the county. For example, this week we have a mobile unit that'll be in locations around the county, including Andy's Unity Park in Santa Rosa today from noon to 6:30. Cottingtown in Santa Rosa on Thursday from June 17th from noon to 6:30. Finley Park in Santa Rosa on Friday, June 18th from noon to 6:30. Elsie Allen High School in Santa Rosa on Saturday, the 19th from noon to 6:30. And then next Sunday at Our Lady of Guadalupe Church in Windsor, that's June 20th from noon to 6:30. So you can see throughout around the community, we're trying to find where people are and bring the vaccine to them. And the great thing is that at all of our clinics and pharmacies, walk-in clients are welcome at every location. So although the state is opening back up tomorrow, our effort to get people vaccinated will continue with a sense of urgency. We really, really want to find the last 25% of the individuals that still haven't got their first vaccine and help them to get the vaccine. We still have big vaccine centers, of course, operating at Grace Pavilion in the Sonoma County Fairgrounds. We have OptumServe operating out of the Rohnert Park Community Center, and we have a vibrant vaccine clinic at Roseland Library. And of course, most commercial pharmacies, all of the regional hospitals, and our wonderful community clinic system, they continue to administer vaccines daily as well. So please encourage your friends and family members who are not yet vaccinated to go to one of these locations and get vaccinated. We'll continue to provide information about clinic sites at socoemergency.org/vaccine and on social media, including the County of Sonoma Facebook page. So with that, let's go back to our communication manager, Paul Gullickson, to help moderate any questions.
And
Thanks, Kent. I think
I'm sorry, that's right. We're going to go to the slides.
we have some
My
slides to
apologies.
present. So
yeah,
Dr.
yeah,
Shinde,
I may
Dr. Mason.
share my screen. Let me just pull it up. Okay. So Dr. Mace, if you wanted to start by going over the cases by episode date.
Yeah, thanks so much. So here is our graph of COVID cases by episode date. And as you can see, after the surge that we saw December, January, and into early February, we've seen a pretty steady decline. And you can see here where the 70% of our 12 plus population is vaccinated. You can see that we've had, we've been really low in cases. However, in the past, let's say 3 to 4 weeks, we have seen an increase in case numbers with some days, actually the last here a couple of days ago, a big spike in cases. And that's a reporting issue. They were all reported at the same day after not reporting the days before. Next slide, please. And I know people are concerned about getting COVID after being vaccinated, but this just shows that the likelihood of that is very, very low. We've had 180 COVID-19 cases occurring in those fully vaccinated out of a total population, as you can see, of close to 275,000 people who are fully vaccinated. That equals 0.07%. So COVID-19 cases have been detected in less than 1% of fully vaccinated individuals. So you're not highly at risk. Okay, and the next slide here shows what we've been saying all along. The majority of cases are among unvaccinated individuals. As you can see, 86.5% of cases in the last 60 days were among unvaccinated individuals. So again, if you're vaccinated, you're likely to be very well and fully protected. Next slide, please. And also, the majority of cases in the past 60 days were among the younger age group, 20 to 39-year-olds. And again, the reason for this is the group that remains with the greatest percentages of unvaccinated persons. So again, this is where we've been seeing the cases largely due to gatherings, either large or small, here in the past several weeks. Next slide, please. And this just shows exactly what we've been saying, that the younger age groups are less vaccinated. The proportion of individuals in the 16 to 34 years of age have not reached 70% yet. As you can see, the 12 to 15-year-olds are rapidly rising, but again, only about 35% of them are fully vaccinated at this time as well. So this is the trend. We need to get those younger folks out, get vaccinated. Next slide, please. And this just tells us what Dr. Shinde and others have already said, that we have not had a lot of hospitalizations. You can see what the trends are after a kind of a peak in hospitalizations in December, January. We've had a pretty steady decrease in low number of hospitalizations, 12 or under really people in the hospital daily. However, there's an increasing proportion of admissions among unvaccinated 18 to 49-year-olds, meaning that even if you're younger, you are at risk if you get COVID of potentially being hospitalized if you're not vaccinated. And we've had 3 COVID-19 related hospitalizations that have been recorded among fully vaccinated individuals. Next slide, please. And this is our COVID-19 fatalities. They've declined, as everybody knows, and our last skilled nursing facility death occurred February 16th. But we did have 1 death of the 316 deaths among a fully vaccinated individual who was over the age of 90 and had an underlying condition. But as you can see here, in April, May, and June, we've seen very, very, very few negative outcomes.
Thank you, Dr. May. So we can go on to Paul Gullickson now.
Yes,
Questions.
thank you all. That's very, very appreciated. So we are now going to start taking some questions from the public and the media. I want to remind our viewers that if they have a question, to please just go ahead and place it in the comments area of either the Facebook page or the YouTube page that they're watching, and we will pass them on to our panelists. And then also our media partners, if you have a question, please just raise your hand and I'll call on you. First one, I start with a question from one of our viewers, Megan. She asks about what about masks for teachers in childcare centers and preschool programs? I know there's some confusion about masks, but I think we kind of addressed that. I know masks will still be required in many of those situations. Isn't that right, Dr. Mace?
Yes, in those kinds of situations, I believe in learning in school situations that masks will still be required.
Yeah. We also have a question from a couple of people who asked about what are the health, the safety rules for camps. And I know, I believe, I know Adam Radke is not with us today, but I know I talked to him about this. There was some new guidance that came out mid-May about camps. And the guidelines are that if everybody in the camp, staff and campers are vaccinated, then there needs to be no limitations. But if not everybody's vaccinated, they do have to follow health and safety guidelines similar to schools. That's what I understand. Dr. Mace, do you have anything else you know about that?
No, nothing else on that.
Okay, that's great. And we have another question. Can businesses still make the individual choice to ask patrons to wear masks? And my understanding, the answer to that is yes, that has been made clear that businesses may ask their patrons to wear masks, and we are encouraging people to respect those requests and carry a mask with them, whether they're vaccinated or not. But that is going to be their choice. So anyway, let's take a couple of questions from our media partners. Let's start with Martin Espinoza. Martin?
Thank you, everybody. Big day tomorrow. So I'm just hoping that, as I know, some of those questions were coming from people who were asking specific areas of the economy in terms of who still has to wear masks. And of course, Cal OSHA is going to, I guess, come make a decision on that or update that on Thursday. But as it stands now, in general, without getting into all the different areas, what is Cal OSHA's mask rule right now? Anybody?
Right now, Martin, the requirement is that offices, unless everybody in the office is vaccinated, that there still need to be masks and show social distancing. So here at the county, for example, we are opening fully to the public tomorrow. But we are going to continue to require people to wear masks when moving about the building and asking the public to wear masks when coming indoors for public business. And that is going to remain our guidelines for the next, at least until June 28th, until Cal OSHA issues its guidelines.
Is that June 28th?
So they're expected to make a ruling on in a couple of days, and then it's supposed to take effect on the 28th, from what my understanding. But I do know also the governor has made rumblings of doing some sort of executive order that may accelerate that timeline, but that is not clear at this point.
So the county in its offices will require, obviously, its employees, but also the public?
Yes, we are going to ask the public to wear masks when indoors. Correct. Yes.
Okay. I had a follow-up question about transmission. So CalCat, or the state's sort of website for forecasts and nowcasts on virus transmission, says that we have one of the highest R effectives transmission rates here in the state. It's likely increasing. And how concerned are we about that? I know that it's a different day today than it was last year. Last year, nobody was vaccinated. Today, we have almost 75% of the population with at least one dose. Is the virus being transmitted at a more aggressive rate among the unvaccinated right now than it was last year at this time among the general population?
Yeah, Martin, those are great questions. Let me first turn this over to Kate to answer or give some information, at least about the R effect. And I know that the team is trying to calculate this data, but Kate, do you have anything you want to add about that?
Hey, Martin. Yeah, so our R effective does show an increase in cases, and we have seen some slight upticks in our case rates per 100,000. It's important to keep in mind, though, that our case rate is still low as compared to what we've seen previously. Today, we're at 4.4 new cases per 100,000 people per day, 4 cases adjusted. It's definitely, you were asking about the transmission that's occurring, and as some of the other speakers have talked about, we definitely are seeing the majority of transmission occurring among younger, unvaccinated individuals. Almost 90% of the cases that we have seen are among the unvaccinated. So I think really the degree of concern, I think some of the uptick in transmission can be expected as we see more gatherings and more travel. And, tomorrow, as restrictions are loosened, we may see some uptick in numbers. But what we need to stay really focused on is what are the outcomes of those cases? Are we seeing increases in hospitalizations? Are we seeing increases in deaths? And really monitoring the presence of variants in our community so we can understand, where we should be concerned. So I think it's really important to monitor those numbers. But at this point, since we are seeing the majority of those cases among the unvaccinated, that seems to be the largest contributing factor that we're noticing at this time, not being vaccinated and gathering.
Thank you.
And to get to your other question, Martin, if you have a gathering of unvaccinated individuals, it really mirrors what we saw last summer because no one is protected. So you would expect that there would be transmission at the same rate that we saw last summer and over the winter with the surge amongst unvaccinated persons. So it's like pockets of our community that are unvaccinated are their own, ground for transmission. So that is what we're seeing. And again, as Kate said, because we've been so effective in getting the vulnerable population with worst outcomes vaccinated, hopefully we're going to see more cases, but we won't, I hope, see any more of the real adverse outcomes like the hospitalizations and deaths.
Thank you.
Yeah, a few more questions from our public. Judy asked, will gyms be allowed to open jacuzzis, saunas, and steam rooms? Our understanding is yes, that is, those will be allowed to reopen. And then the question is about what about hair salons, barbershops, nail salons? Those also are covered under the business that will be allowed to reopen tomorrow. So we appreciate all those questions people are asking for on specifics, and that's helpful. But just to reiterate that the state will be reopening tomorrow, and on those businesses, there won't be limitations on indoor operations. Let's go to Catherine Ho. Catherine?
Hi, can you hear me?
Yeah, you're on.
I have a couple questions about vaccinations. I'm curious if you're seeing a significant number of people who've gotten their first dose but haven't gotten their second within that 42-day window of time. And if so, is that concerning, especially with the Delta variant potentially picking up in the next several months?
Catherine, this is Ken Tassif. So we've pulled reports on that exact number of people who have not received their vaccine, their second vaccine after 42 days. And there's a significant number out there, but what we're trying to analyze is how many of them it's on paper and how many have actually missed their second dose. Remember that there are multiple providers out there, hospitals and of course our FQHCs and the pharmacies and others that have been entering the data, and especially at the very beginning, not all the data was clean. So we've been working with our partners to try and make sure that the data is clean, and that those individuals that have missed their second dose, actually we can identify them, and we are reaching out to them to try and get them most importantly, we're reaching out to them, finding out why haven't you got your second dose, or asking them at least, and then trying to sign them up for an appointment to get that second dose if they're late.
Can you share any numbers on roughly how many people in fact have missed their second from the clean data, as you said?
Yeah, we have not gone through all the data yet, but we're working on that now. I expect in the next week or so we'll have a better understanding of where we're at with that number. We are getting it cleaned up we are working with partners to get that cleaned up, and you'll notice that in the fact that if you look at the first dose number on our website, it's gone from like 16% down to about 9%. Now, and that's a matter of getting it cleaned up. But I don't want to speculate, but I do believe that there will be a significant number of individuals, let's say over 5,000, I would guess, that did not get their second dose after 42 days.
And one more follow-up, if I may. I'm sorry, it'll be my last one.
Yeah,
do
no
you have any estimates or data on whether there's any new cases among people who are partially vaccinated?
We'll leave that for Dr. Mace or Dr. Shendy, or Kate Pack. I'm sorry.
I think Kate may be the best to answer that.
Dr. Shende, if you share the slides again, that's actually displayed on one of the slides. Yeah, if you can scroll through. Yep, this slide. So you'll notice the light orange on the bars. Let's see, partial is the light blue, I mean. Yep, so the light blue are the cases in the past 60 days that were among partially vaccinated individuals.
Great, thank you.
So we have one question from our viewers. There still seems to be some confusion. She's asking, are people who have already had COVID, should they still get a vaccination? Dr. Shendi, you want to take that?
Yes, so if people have had COVID, yes, they may have some partial protection, but the studies have clearly shown that it's still important to get vaccinated afterwards, particularly because of the variants that are out there right now. The vaccine seems to afford better protection against the variants than what one might have gone through the first round. In addition, getting the vaccine seems to stimulate different parts of the immune system and provides better protection than, in some cases, natural infection. So yes, if somebody did have COVID, they certainly should go ahead and get the vaccine to make sure that they are completely protected.
And then we have another question, and I'm hoping you could help address it. There is some confusion about what it means for the Pfizer and Moderna wanting full FDA authorization versus what they have now and when that might occur. Could you explain that for the vaccines?
Yeah, so emergency use authorization, which is the situation that we have right now, is when a vaccine or medication has been thoroughly evaluated and its safety and its efficacy is established, well established. But because of an emergency situation such as our pandemic, it hasn't been granted full use such that it cannot be patented. So at this point, there is talk about when they will lift that EUA authorization and when it will become a regularly sanctioned medication. I don't know that there has been any date set, but they're looking at later this year, later in 2021 or early 2022, but no specific date has been set yet.
Okay, great. Martin, did you have a follow-up?
Yeah, I do. I know one of the big concerns about transmission is the possibility of variants. Does the virus care whether the people who are getting infected are mildly ill or asymptomatic? For hard to phrase this, is the probability of a mutation the same among the asymptomatic and or mildly symptomatic as it is among those who get really sick?
Go ahead, Dr. Shende.
That's a very good question. And I don't know if research has borne that out at this point. I mean, basically, whether somebody is without symptoms or has mild symptoms or is severely sick, that person is going through, the virus is going through their system. And I don't think that it makes a difference. What is important is that anybody who is unvaccinated and who is susceptible is a person in whom that virus can mutate, that virus has more opportunity to mutate. And that's exactly what we've seen worldwide. That's why we have so many variants out there right now. I think that whether one is asymptomatic, mildly or severely symptomatic, really depends more on one's situation, one's health status and constitution more than anything. Dr. Mesa, I don't know if you want to add anything to that.
No, I think that's accurate.
Yeah.
This
Bottom
is the
line,
re-
best to get vaccinated to prevent these variants prevent new ones from developing and to keep everybody healthy. That's the bottom line.
Well, yeah, that's the reason I asked, because I think there's an impression out there right now that we may have a lot of transmission among the unvaccinated, but they're all healthy and young and they're not going to get that sick. But there is that possibility of a variant.
Yeah, and
Exactly.
we did show the data that even amongst the younger age group, we've seen more hospitalization. So that is of concern. So I think there are some people who are getting sicker.
Thank you.
And again, the more transmission we have, then the more that people are going to end up getting very sick and end up in the hospital. It comes right back down to the more protected we are, then the better off everybody is in the community.
Thanks.
Thanks, Martin. Catherine, did you have a follow-up as well?
Thank you.
Okay, I think that was no. We have just one more question, and that has to do with, again, specific questions about are masks going to be required in hair salons? I think primarily the guidance is that there will be no requirements for masks moving forward. Now, a salon may request that their customers wear masks, but it's not a state mandate. Is that your understanding, Dr. Mays?
Yeah, that's accurate for patrons. Now, where it gets a little bit more cloudy is with employees of businesses, like the hairstylists, for example, or those people working at a restaurant. And that's what we're waiting for Cal OSHA to, the next meeting, I believe, is this Thursday, and we'll have some clearer guidance for employers and businesses about their employees. But if you're going to go into a hair salon and get your hair done, there's no need for a mask. Again, what I would say is, if you're unvaccinated, be ultra careful and take precautions for yourself. If you're vaccinated, there should be no issue at all.
That's why I think when most people go to a grocery store tomorrow, they may find that they don't have to wear a mask starting tomorrow, and that restaurants will be fully open indoors and whatnot. Those are what I would expect to see, what we're expecting for people to see in Sonoma County tomorrow. Marty Thompson, you have a question? Marty, can you hear us? I think you need to unmute.
That should do it. In the Oakmont Village Association has made it a point that they're adhering to county regulations by limiting the number of people who can use things like swimming pools and a fitness center. That goes away tomorrow.
I don't know if you could all hear that. Marty was a little quiet, but the question is are the limitations on use of the pools and fitness centers, recreation centers, they'll be lifted tomorrow as well, correct?
Thank you.
Yes, your answer is yes. Susan Walbarst. Welcome, Susan.
Oops. Hi, sorry. I just had a question about people who are fully vaccinated. In the beginning, they said the vaccine was approximately 95% effective. So would a fully vaccinated person truly not have to worry walking around with all these unvaccinated people who are not wearing masks? Or could a person still get COVID 5% of the time from just doing their normal daily activities?
That's a great question. Thank you for bringing that up, Susan. I think that it's important to remember that these are numbers, and what the numbers have shown so far in Sonoma County and nationwide is that the breakthrough rate is actually much lower than we anticipated. So in Sonoma County, it's about 0.07%, so less than 1%. Now, of course, that depends on who that individual is. So if that person has an immunocompromising condition, if they have other issues, comorbidities, that's going to affect their individual immune system. But for a person who's completely healthy, who has absolutely no issues, one can assume that their chance of contracting COVID after being fully vaccinated plus 2 weeks is somewhere in the range of 0.07% to maybe 5%. It's very, very low. And in fact, there aren't very many vaccines at all that have such a successful effectiveness rate. It's extremely effective. But again, people really need to take a look at their own conditions. And if they're on medications that will affect their immune system or a condition that may affect it, then need to take extra precaution and realize that the vaccine is going to help them in case they do get COVID, but still need to be cautious.
The risk also depends on the level of transmission in the community, which is why earlier what Martin was asking, is there rampant transmission amongst unvaccinated persons? Well, there's definitely a lot more transmission amongst vaccinated. So, so in other words, if you are vaccinated and you are with unvaccinated persons, then you may have, even if you've been vaccinated, you may have a risk of getting COVID. But so it really depends on the level of transmission in the community. And our transmission rate is much lower than it was at the peak of the surge.
So help me understand the difference. Originally, they said the Johnson & Johnson vaccine was something like 60% effective. So I wonder, have there been studies about which vaccines these fully vaccinated people had became the breakthrough cases?
Yeah, Kate, we do have data on our cases that have occurred in fully vaccinated persons in terms of their genotyping. Now, we don't have full data, I believe, because it takes time to get those results back. But Kate, what does our data show so far?
I can find that slide. I want to find that slide before I respond to that, but we do have data on that. If we don't have time in this conference, I can send that to you after, Susan. But I will look that up right now.
Okay, thank you.
Okay, thank you, Susan. Thank you, Kate. Let's go to Tessa Paoli. Tessa, can you hear us?
Hi there, can you hear me?
Yep, you're on.
My quick question is just, what is the recommendation for vaccinated people in terms of testing? Yeah. That was my question.
So at this point, for a person who's completely healthy, if they're not required to test, then there's no need to. There may still be certain situations, senior facilities, for example, some healthcare facilities where they may require testing just for surveillance. However, but in general, if somebody's fully vaccinated and they've been exposed to somebody with COVID, they do not need to be tested unless they have symptoms, then it would be advisable. Does that answer your question, Tessa?
Yes, thank you so much. I appreciate it.
You're welcome.
Okay, I believe that's the end of our questions. We're getting near the bottom of the hour. We just want to thank all of you for being here today. Tomorrow is a big day, but we know there's a lot of questions, and we thank you all for joining us. And if you have any questions, or please reach out to us at publicaffairs@sonoma-county.org, or check out our website, socoemergency.org/vaccine, where there's a lot of information available to help address your questions. In the meantime, thank you all for being here, and stay safe, everybody.